USMLE style question, obstructive versus restrictive lung disease mechanics. Question: a 55-year-old man with a history of COPD and a 50-year-old woman with a history of idiopathic pulmonary fibrosis are both undergoing pulmonary function testing, PFT. Which of the following best describes the difference in work of breathing, WOB, between these two conditions? A. Both conditions increase WOB, but COPD patients work harder during inspiration, while pulmonary fibrosis patients work harder during expiration. B. Both conditions increase WOB, but COPD patients work harder during expiration, while pulmonary fibrosis patients work harder during inspiration. C. COPD increases WOB due to decreased lung compliance, while pulmonary fibrosis increases WOB due to increased airway resistance. D. COPD increases WOB by decreasing lung compliance, while pulmonary fibrosis decreases WOB by reducing airway resistance. E. COPD and pulmonary fibrosis have similar effects on WOB, as both reduce lung compliance and increase expiratory effort. Correct answer? B. Both conditions increase WOB, but COPD patients work harder during expiration, while pulmonary fibrosis patients work harder during inspiration. Work of breathing, WOB, is affected differently in obstructive and restrictive lung diseases. Obstructive lung disease, COPD, asthma, chronic bronchitis, emphysema. Problem: increased airway resistance, bronchoconstriction, mucus, airway collapse. Breathing pattern: harder expiration due to dynamic airway collapse and air trapping. Key physiologic change: increased residual volume, RV, and total lung capacity, TLC, due to hyperinflation. Main effect on WOB: increased expiratory effort. Restrictive lung disease, pulmonary fibrosis, interstitial lung disease, sarcoidosis. Problem: decreased lung compliance, stiff lungs resist expansion. Breathing pattern: harder inspiration due to the effort needed to expand stiff lungs. Key physiologic change: decreased TLC, FVC, and RV, lungs can't expand fully. Main effect on WOB: increased inspiratory effort. Why not the other choices? A. COPD patients work harder during inspiration, while pulmonary fibrosis patients work harder during expiration. Incorrect. Expiratory difficulty, pulmonary fibrosis inspiratory difficulty. C. COPD increases WOB due to decreased lung compliance, while pulmonary fibrosis increases WOB due to increased airway resistance. Incorrect. COPD has increased airway resistance, not decreased compliance. Pulmonary fibrosis has decreased compliance, not increased airway resistance. COPD increases WOB by decreasing lung compliance, while pulmonary fibrosis decreases WOB by reducing airway resistance. Incorrect. Pulmonary fibrosis does not reduce airway resistance, it reduces lung compliance. E. COPD and pulmonary fibrosis have similar effects on WOB, as both reduce lung compliance and increase expiratory effort. Incorrect. COPD affects expiration, pulmonary fibrosis affects inspiration. Key learning points. COPD increases WOB due to airway resistance, making expiration harder. Pulmonary fibrosis increases WOB due to lung stiffness, making inspiration harder. COPD causes air trapping, leading to increased RV and TLC. Pulmonary fibrosis reduces lung volumes, TLC, RV, FVC, but maintains or increases FEV1-FVC ratio. COPD equals prolonged expiration. Pulmonary fibrosis equals rapid, shallow breathing. Would you like a question?